Hi, my name is Megan Stevens, and I'm going to be demonstrating 4 stretches for my corrective flexibility plan for knee valgus. Knee valgus is a condition where your knees medially rotate or move inward and your feet kind of point outward. It's nearly impossible to do if you don't have that condition, really. Anyways, the first stretch I'm going to do is the gastrocnemius, or this calf stretch, the back of your calf. The reason I'm stretching the calf is because the reason your feet point outward when your knees move inward is just because of ankle flexibility being kind of compromised. So first, you can use a chair or a shelf or whatever as a brace. You're going to stand about arm's length away, use it for balance. Step forward with one foot, and the leg that you want to stretch, you can move backward as far as you can. But the biggest thing you need to think about is having your heel to the ground, because that is what is actually going to stretch your gastrocnemius. You should feel a pull in the back of your calf, nowhere else, especially kind of in the inward part of the calf, kind of right here, as opposed to right here, kind of in the medial part of your calf, and hold for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. With all stretching, you want to make sure that you have proper posture. That means your shoulders are kind of back and your core is tucked in and nice and tight. 25, 26, 27, 28, 29, 30. The next stretch I'm going to do will be the standing adductor stretch. Your adductors are your inner thigh muscles. And because your knees are kind of getting pulled inward, that means that these muscles are very, very tight, as well as kind of your hip flexors, but I'll talk about that next. Okay, so you're going to start with your feet shoulder width apart, and you're going to widen your stance, and then I'm going to be stretching this inner thigh, so I'm going to place my body weight on the opposite leg, bending my knee, leaning to one side, and keeping this leg absolutely straight. That means all 3 points on the foot, on the ground, heel, big toe, and pinky toe. I'm going to lean forward and stretch and hold, and you need to be able to feel tension, but any stretch needs to be held for 30 seconds. So do not overdo it here. You'll pull a groin muscle, literally. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Just ensure that your feet, that you're balanced, and that all points on your feet are firmly on the ground, okay? You want to feel a stretch, not pain. 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, okay? And now I'm going to demonstrate 2 self-myofascial release techniques with a foam roller. Self-myofascial release techniques are really important for kind of untying the knots in muscles and myofascial tissue. Myofascial tissues kind of are lines of connective tissue that kind of connect the human kinetic chain. So it's very important that everything is kind of in line and working together. So the first one I'm going to do is the gastrocnemius one again. So I'm going to sit with both my feet straight out in front of me. I'm going to stretch this calf, so I'm going to put the foam roller underneath that calf. I'm going to bend my opposite leg at kind of a 90 degree. I'm going to use my arms, specifically my triceps, to lift up my pelvis and use my body weight to kind of find that literally sore spot on my calf and really grind it out. So it's massaging it. So I want to find that sore spot, which is about right here for me. Okay, and I want to hold that there using my body weight as the kind of force for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, self-myofascial release can be quite different from what people are used to. It is very much aware of it. So just kind of warn your clients and kind of get them to explain to you what level of strain or tension they're feeling. You don't want it to be necessarily super painful. 26, 27, 28, 29, 30. It is a little bit uncomfortable, but it feels amazing after it's done, okay? Now the next one I'm going to do is the IT band, self-myofascial release. This is very important because the IT band is a line of connective tissue that connects your hip flexors and extensors, your knee extensors, knee flexors, and your ankle flexors and extensors, dorsiflexors, plantar flexors. So that, and those are all three of those joints. So your hip, your knee, and your ankle are the joints that are kind of compromised or imbalanced, those muscles within those joints that are imbalanced with knee valgus. So doing this one is very, very important to help correct. It's also kind of one of the most difficult to do, needs a lot of coordination, as well as it can be quite painful, just to be honest. So warn your client, maybe work up to this. How do you kind of cue this? Feet, legs straight out in front of you. Align the foam roller with kind of your hip bone. That's my hip bone, that's it there. I'm gonna put my arm directly behind it. I'm gonna bend this leg because I'm going to be massaging this one. I'm going to pop up on my hip, rotate, and then push the foam roller underneath, right underneath my kind of pelvic hip bone there, okay? And then I'm going to use my arm and upper body strength to kind of find that extra sore spot, okay? And for me, that is about right here. So I'm gonna kind of just gently, but in about a kind of a 2-inch place, kind of roll around it for 30 seconds, okay? You have to be able to do it for that long. So 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, when it comes to stretching, especially corrective flexibility, you gotta make sure to do these stretches before any long cardiovascular weight training session, but also make sure the muscles are a little bit warm. So about 5 to 10 minutes of light aerobic activity, just to make sure the blood is flowing and everything, because stretching cold muscles can cause injury as well. Okay, so thank you very much.